Breast augmentation is a great procedure, and it can be done safely using a minimally traumatic technique with 14 important points to get a safe result with the lowest risk of complications. Modern breast implants have been shown to be extremely safe. It's a cohesive gel, not a liquid, inside of a silicone pouch. A good surgeon will go in commonly through the fold with a 1-inch incision, using a tiny lighted retractor, make a perfect little pocket that's exactly the right size for your planned implant. It's important to use a meticulous technique to create a pocket with a bloodless approach. We want to address each little blood vessel as we go. We don't want blood to spill into the pocket, which can be inflammatory. Then, once the pocket is perfect for the planned implant, there'll be a little bit of scoring of the lower aspect of the breast to release the old fold. We don't want to get a double bubble or a crease along the front of the lower breast. We rinse out the pocket with a chlorinated fluid, sterilizing it. I like to use pain blocks so that the whole pocket is numb. I place most implants today on top of the muscle but under the muscle fascia so that the biology of the muscle fascia is creating a nice pocket around your new implant. Currently, I'm using the Motiva implant if it's on top of the muscle. Sometimes I'll use the Allergan implant, but I place it under the muscle because when I use that smooth Allergan implant on top, we get more scar tissue. Then we change the outer gloves, we bring over different instruments, re-prep the skin, rinse the pocket with a sterilizing fluid, and then we do an implant sizer, testing the pocket, looking at the shape and position of the implant to make sure we have the perfect implant to fit the goals that you've set relative to the tissue that you have. Once everything's perfect, then I'll do some finesse with the sizer in place, gently softening the lateral breast and perfecting the cleavage. We want to keep the nerves intact. The nerves to the nipple come in laterally, and there's one medially, so I'll do those with a little finesse from the inside. We don't want to cut those. So very careful about that. Then once we have our final implant selected, I'll take out the sizer, rinse the breast once more, and then place your final implant, having changed the gloves again, using a virgin glove to pick up the implant that nothing's touched, placing it into the Keller funnel, sliding it into the breast. That pocket is perfectly ready to receive it, and the implant didn't touch the skin, and that's what that Keller funnel is going to do, is keep that re-prepped skin even from touching your implant. The implant slides into the pocket, we test it, make sure everything's perfect, and then we do a 3-layer closure with absorbable sutures. There's no sutures on the outside, medical glue, medical tape. We put you in a soft bra. Sometimes we'll do a little liposuction of this axillary tank top fat area to smooth that out because we want that nice lateral curve. We don't want the B on the side boob, we want the nice S-shaped side boob. Then we'll put you in a soft bra, little foam if we do liposuction, and send you home to rest, sleeping up on 2 pillows, taking 4 or 5 days, very light activity at home, so that we don't do too much or overextend ourselves. We don't want to develop bleeding in the pocket because that can cause scar tissue. And after day 4, day 5, you can go back to normal light activity, activities you might do with a hot cup of coffee in your hand. Things like drive, window shop, go to dinner, but don't carry anything heavier than a milk jug. Don't pick up big toddlers, no big exercise or running for about 3 more weeks. Once you get to week 3, you can do long walks where your heart rate goes up. You can do more activities, but no big running, big fitness, bouncy activity, or athletic sex for 6 weeks post-op. In summary, breast augmentation is an easy recovery. If we're doing it on a Thursday, you can be back at work on Monday. It's not very painful because we're putting it on top of the muscle in most cases and using pain blocks. And as long as you can give yourself a long weekend to recover and light activity for a few weeks with no big travel, you're going to do great. There will be swelling post-op. For about 6 weeks, you'll look a cup size bigger than you planned. Starting at week 6, the swelling will come down. By 3 months, most of the swelling is gone, and by 6 months, all of the swelling is gone. It's a wonderful procedure for patients who want more volume safely. I love the results we're getting with the Motiva implants, and I've had a lot of great experience with the Allergan implants. Love those breast augmentations. Fabulous.